Hello and welcome to this presentation on how best to communicate risk to your patients with inflammatory bowel disease. I am Dr. Jamie Willows.
And I'm Dr. Alice Wiedner. Over the next 8 minutes, we hope to define risk communication using an example case of a doctor-patient interaction and encouraging you to think about how best to communicate the probability of risk. Our target audience is junior trainees, nurse practitioners, or anyone who wants to brush up on their risk communication skills.
Risk communication is defined as the open, two-way exchange of information and opinion about harms and benefits, with the aim of improving understanding of risk and of promoting better decisions about clinical management. Wordy, we know, but risk unfortunately at times can be poorly communicated by us and by the tabloids.
Good communication of risk needs to cover the effect of the event on the patient, the importance of the adverse event being described, and the probability of the risk occurring. The effect of an event on the patient can be appreciated by exploring their ideas, values, and concerns. However, for today we will focus on point 3, as it is difficult to communicate the probability of events happening to a patient. Let's look at an example of a consultation where the doctor has to explain the probability of a drug side effect occurring to a motivated patient. We have deliberately chosen a case in which the very small numbers involved make risk communication challenging.
Doctor, I am so pleased that my Crohn's is in remission, thank you. But I'm still taking this azathioprine, and I've been reading about the risk of non-Hodgkin's lymphoma on the internet and think I'd like to stop taking it.
Thanks for telling me your concerns. I'm sorry to hear you've been worried. Reports in 2009 showed doctors that azathioprine doubles the annual risk of non-Hodgkin's lymphoma, but this complication remains very rare. In fact, at baseline, only 0.02% of patients will get non-Hodgkin's lymphoma, compared to 0.04% in patients on azathioprine. Also, please bear in mind the number of patients who will be in remission due to azathioprine, as we've discussed before.
Let's take a second to think about this scene, specifically what was done well and what could be improved upon. So I think the doctor here did a great job of expressing empathy to the patient and addressing their concerns, knowing their facts with regards to the drug and balancing potential side effects against clinically relevant benefits. Though this case involved IBD, the learning points could be applied to all clinical scenarios.
Consider the following 5 tips to improve communication.
1.
Patients struggle with small percentages, especially decimals. 80% of patients cannot convert 0.1% to 1 in 1,000, so will struggle with converting the numbers this doctor used. Consider replacing small numbers with frequencies like 4 people for every 10,000 patients, which have been shown to be better understood. You can help the patient to picture 10,000 people by comparison with the capacity of a local music or sporting venue as relevant.
2.
Next, consider that vague phrases such as very rare can be interpreted differently by doctors and patients alike. In one study, patients interpreted the phrase very rare to mean 4%, whereas the doctor took it to mean under 0.1%. Similarly, the phrase very common should be used with caution.
3.
A negative framing effect occurs when you describe how many patients develop a side effect, but don't relay the patient number without said side effect. In this case, the doctor explained how many patients developed lymphoma on treatment, but not explicitly how many did not develop lymphoma.
4.
Expressing relative risks can lead to patients falsely interpreting a greater amount of risk, like when our doctor stated that the risk of lymphoma was doubled. We would suggest considering the use of absolute risk instead.
5.
Additionally, you could consider giving some perspective by comparing the side effect risks with other risks in daily life. For example, your annual risk of dying in a car accident is 1 in 9,000.
So there we have it. We now have our 5 risk communication tips. Considering these points, let's look at an improved communication of risk.
Thanks for telling me your concerns. I'm sorry to hear you've been worried. Reports in 2009 showed doctors that azathioprine increases the risk of non-Hodgkin's lymphoma. Try to imagine 10,000 patients like you with Crohn's disease. 2 will be diagnosed with non-Hodgkin's lymphoma each year if they're not taking azathioprine. However, if all 10,000 patients were taking azathioprine, then 4 of them will be diagnosed with non-Hodgkin's lymphoma each year. Although azathioprine will have caused an extra 2 cases of the lymphoma, still 9,996 of the patients will not be affected. This is equivalent to over 99.9% of the patients not being affected by the lymphoma. You need to balance how you feel about this risk compared to the risk of a Crohn's flare-up should you stop taking the drug, as we've discussed before. Now that's quite a lot of information. Can I get you to repeat that in your own words so that I know you've understood me?
This time the doctor kept doing all the things she'd done well the first time, but avoided some of the pitfalls by incorporating some of the tips into her practice. However, it still isn't easy. You may need to go over things again with the patient, and it is good practice to check the patient understanding at the end. Also consider using printed visual decision aids to help you explain the concepts and aid decision making. To introduce you to these frequency diagrams, we will move away from the very small numbers of the scenario and focus on common IBD complications.
There are many circumstances in IBD management that printed decision aids may be helpful. Consider if you could provide these frequency diagrams for your interested patients to explain the odds of serious infection as per the SONIC trial on azathioprine, infliximab or combination therapy. Or to describe the lifetime risk of surgery in Crohn's disease. These diagrams have been shown to aid patient comprehension.
In conclusion, we have defined risk communication and its benefit in shared decision making. The probability of events happening is difficult to communicate, and we introduce some visual decision aids which may be helpful in communicating your message.
We also discussed 5 tips to avoid the common pitfalls and improve your risk communication, namely, firstly, do use frequencies and avoid decimals and small percentages. Secondly, avoid vague terms, for example, very rare. And thirdly, avoid the framing effect.
Fourthly, do use absolute risk and do avoid using relative risk. And finally, consider comparison of risk with the other risks of daily life. So I have been Dr. Alice Wiedner.
I have been Dr. Jamie Willows.
So until next time, happy scoping!